My name is Dr. Tom Adams, and I'm a surgeon here at Wyoming Surgical Associates. So I'm a general surgeon, so I treat a wide variety of surgical conditions. These mostly center around the abdomen, so think gallbladder, hernias, colon, small bowel, things like that. But I also do surgeries such as skin and soft tissue excisions, breast surgery, and thyroid surgery. So I have a background in exercise physiology and sports, and I decided to pursue surgery because I really liked being able to fix problems quickly and directly. I attended medical school at St. George's University in Grenada, and then I completed my general surgery residency at Marshall University in Huntington, West Virginia, which is an awesome community, very similar to Casper, very similar population, very similar environment. So the transition was really, really easy moving here to Casper. I would tell my younger self in medical school to pay attention to every single patient and every single experience that you have, because any patient that you see can make you a better physician in the future. I really tried to do that as a student, and I feel like I can now value every patient a little bit more. So one thing I tell patients about surgery is to remind yourself that surgery is a process. It's not just one moment in time. Actually, performing the procedure is only a brief moment. And then aside from that, you have weeks to months, depending on the procedure, in order to recover. So one piece of advice that I'd give patients is to really try and optimize your health ahead of surgery, rather than seeing surgery as a fix to whatever problem you're having. So examples of that would be try to exercise regularly, try to eat as healthy as you can, and then cut down on bad habits like smoking and drinking. And doing all those things will help you recover from surgery faster and have less pain after surgery in those weeks to months. For me, the most rewarding part about being a surgeon is being able to fix problems quickly and seeing results immediately. For example, if somebody comes to our office with a gallbladder problem, even before they leave the hospital after surgery, typically they feel better. They might have a little bit of pain from their incisions, but the pain they had is gone immediately. And I really, really like that. So as far as innovative surgical techniques that I like to use, I make very liberal use of the Da Vinci robotic surgery platform. This is a technology that allows us to perform minimally invasive surgery with more dexterity and perform more complex procedures than we were able to do previously using traditional laparoscopy. I find that by doing procedures with the robot instead of doing open procedures, I can cut down on the patient's pain, and I can also make recovery much faster. So I'm currently trying to expand the number of procedures that I can do using the robotic surgery platform. So my favorite thing about living and practicing here in Casper is really the people. The people are so friendly and so welcoming. I've only been practicing for a short time, and I've felt nothing but welcome since I've been here. So a fun fact about me is that I'm actually not a US citizen. I was born and raised in England. And yes, I know the accent's gone. Well, surgeons play a role in the health of the community because a lot of the time, surgical problems can be very debilitating for patients, especially things like big hernias or gallbladder problems. And by fixing those problems, we can allow patients to get back to the lives they want to live, whether it's going out and hiking, fishing, hunting, or even just leading a healthy life in general. Patients should choose Wyoming Surgical Associates if they want compassionate care from skilled surgeons right here in Casper. In the past, a lot of patients have been referred out to bigger cities like Denver or Salt Lake City for complex surgical problems, but really most problems we can take care of here in Casper. So if you have any questions about a problem that you think we may or may not be able to deal with, I encourage you to call and talk to one of our staff.